the feature that would make them qualify as normal cells. So these are captured under atypical cells. So the typical cells are normal cells, while atypical cells are abnormal cells. So essentially, when we talk about cells, you should always know that these cells, there is a way they would appear in their normal status. And when they are not in this particular fashion, it means there is a deviation from how something is expected to look like. And these changes are what we understanding these changes, recording and noting these changes are what we rely on in what we do for us to be able to reach that convincing diagnosis that this is what is wrong with the patient, and this is how we can actually the signs that we are seeing in the cells are what we can now put together and reach that conclusion that this is the true identity of what the patient is dealing with. Now, when we see, in many cases, when you guys talk about cells and cancer, and many people believe that if a cell is not normal, then it simply means it is cancerous cell. But no, this is wrong. This is not something that happens overnight. And that is why the topic says atypical cells and malignant cells. There is a lot of difference. There is a lot of changes that will not happen overnight before a normal cell will become cancerous cells. So before I jump into assume that you guys know what cancerous cells are. So I would like to, guys, I will mention your name. You tell me the properties of cancer cells. So Olusegun Adeyemo, what property of cancer cells do you know? I'll kick you out if you don't answer me on time. Sultan Olusegun Adeyemo, what properties of cancer cells do you know? I don't.
Huh? Hello?
Now answer my question.
What did you say, sir?
You know the number of times I mentioned that question. Where were you?
Sir?
You're not serious. Get out of my class. So Chukwemeka Israel.
So they are larger in size and absence of normal features of the cell.
Idris Peace. Idris Peace.
So they have abnormal shape of and size of the cell is abnormal in shape and size compared to the normal one.
Olúwapẹ̀lúmi Akínwálé.
So I think multi-nucleation, you have and hyperchromation.
Favor Ogbonna.
So they divide at a rapid rate.
Obumneye, give me another one. Somebody has mentioned what to type. Yeah, very good. Obumneye said high nuclear cytoplasmic ratio, multinucleation. Then who else do we have here? You know yourself. I'm trying to get your name.
They have abnormal membranes.
Pelumi, why are you just joining us? I've never seen you in my class.
I've been always coming to your class, sir.
Did you participate in the mid-semester?
Yes, I did, sir.
Okay, so all these features that you can turn on, all these features that you guys mentioned, they are the stuff that we see in cancer cells. But these changes don't happen overnight because there are some changes that would initially start and are eventually resulting in the cancer. So, and these are captured under atypical cells. Before a cell become cancerous, it would have acquired some changes that at the early stages may be reversible. But when these reversible alterations are not really what we are not there for us to really see, then that can actually bring about permanent changes that would now lead to the stuff that will become full blind. So these are the issues that we want to mention today. So normally some cells are really the same way that they are. from the way that from the moment where they are created. What I'm talking about is that there are some natural processes that happen in the body that would put the cells through harsher conditions, more harsh conditions that they are familiar with. For instance, stress is a normal process in the body. And so, for instance, let's say a cell, when a cell is subjected to more pressure than it is familiar with, it can undergo some changes in its effort, in its struggle to keep up, to adapt to the stress. And this is, for instance, now if you are expected, if you want to carry a very load on your head now, if it's something that is light, let's say something like my headphone now, if I put it on my head, I may not feel the weight. But if I carry my mic, if you want to carry a microwave on your head, you begin to say that, okay, this is not, but I can still survive. But if I now want to carry, I don't know, how are you going to carry something like my fridge, like a standing fridge that I have over there? There is no way you are going to comfortably carry that on your head. But some people can still struggle. So the
I have to
damage
have
that,
muscle.
eh?
I have to have muscle.
Yes, but even if they force it on your head, it doesn't mean that you are not going to die immediately. That's my point. It may be very strenuous. It will be very, it may assert more pressure on you, but you will still survive it. But in your ability, in your struggle to keep up with that particular pressure, at the cellular level, those things also happen there when the cell will be subjected to higher than normal pressure. But it doesn't mean that automatically it will become a cancerous cell. There are some changes that the cell would go through because of the additional pressure that it is subjected to. But these changes are reversible. So two of those changes are called hypertrophy and hyperplasia. So what is hypertrophy and what is hyperplasia? Favor, let me start with you.
So what do you say?
What is hypertrophy?
One time, wait.
What are you looking for? What do you know? Don't tell me what you can quickly get online. What
No, I'm
do
not
you
checking
know
the
now?
internet. Like you said now, you said that like if like a particular cell is trying to adjust, so it sometimes
Do
you
you
have
know?
that like increase or reduce. So one of them is increment, and the other one is, I think, hypertrophy is like increments in the size of the cell to adjust to.
So have a look at your screen. When we talk about hypertrophy, we are talking about a physiological change. Okay, it's a physiological change. It's a normal change in which the size of a tissue or an organ increases because the size of the individual cells have increased. For instance, now, you know a rubber band. When you have a rubber band, I'm trying to see if I can find one very close to me here. When you have a rubber band and you extend it, when you stretch that rubber band, it increases in length. Okay, but when you remove your finger in stretching the rubber band, it returns to its original size. What is simply happening is that the stuff that are making up that rubber band, you are stretching them. The atoms, the molecules that are making up that rubber band, you are stretching them. And in the course of stretching them, you are increasing the size. You are increasing the size of the particular, of the entire material. So that is what is happening in hypertrophy. Unlike what is so, if I will use another example, what I think I can use is that when you can you see a blank word page?
Yes, sir.
Yes, sir.
Now, let me see picture. Let me see drawing. There used to be a drawing. Okay, yeah, draw. Now, so let's say oh, so let's say what you have here is the normal size of the cell in its normal cell. Pelumi, can you see what I just drew? The circle I just drew.
Yes, sir.
Yes, sir.
Now, so this is the normal cell. Now, if it now changes to this, it simply means it's not because there are more cells in that place. It's because we've now stretched the cell. So which simply means that this one will be small, but this one will be large because we've stretched the particular cell with the tissue, because the cells in that tissue, they've been stretched. But this is different from what happens when, and this what we just described is hypertrophy. There is an increase in the size of the tissue because of an increase in the size of the cell. But the difference between this and hyperplasia is, in hyperplasia, let's say in hyperplasia, let's say this is the size of the cell, okay, and this cell has this cellular, this component. So these are the cells that make up this particular tissue. But in hyperplasia, it has now increased to this part. Okay, I want to draw something bigger. So it has now increased to this. As you can see, the stuff that are inside these ones are now, they are more numerous. The cells that are inside this particular tissue. Favor, in the first one, how many circles can you count?
So in the first one, 4 circles.
In the other one, how many can you count?
11 circles.
At least, so you can see that there is the space that 11 cells would occupy would be bigger than the space that 4 cells will be occupying. So the increase in size of a particular cell due to the increase in the number of cells is called hyperplasia. Akinwale, can you recap what I discussed? Describe hypertrophy and hyperplasia.
Okay. Yes, hypertrophy is when there is increase in size of organ because the size of the cells are increased. But in hyperplasia, the size of the organ is increased because the number of cells in the number of cells are increased.
So that is what is happening in hypertrophy and hyperplasia. So, Sultan Olusegun Adeyemo, what is the difference between hypertrophy and hyperplasia?
Hypertrophy. Hypertrophy is the increase of enlargement of size of the cell.
Did you get my question? What is the difference between hypertrophy and hyperplasia? That's my question.
Difference.
If you are with us, is a simple question. Guys, you need 100% concentration.
So I can't hear you.
Hypertrophy, it's the size of the cell increases. While hyperplasia, the number of cells increases.
No, that is wrong. Bolu Atife Adekoya. Bolu Atife Adekoya.
Yes, sir.
What is the difference between hypertrophy and hyperplasia?
I'm just joining the class now. I just joined now, so.
So you never, in your life, you've never had hypertrophy before?
I have.
So So what do you know? What is hypertrophy? What is hyperplasia? Let me know what you know.
Um, hypertrophy is the increase in size of cell.
Who knows? Who can give me a very convincing answer? Anybody, please. I want to make progress.
Okay. Okay, sir. Let me just answer. I heard you. Oh,
Okay.
does somebody want to answer?
No, favor, go ahead, please.
Okay, so that hypertrophy is increase in the size of a tissue or an organ due to the increase in the sizes of the cell. Like, you gave us an example. You drew like, okay, imagine a rubber band there. Like, just okay, imagine a circle, the tissue containing different cells here. So what happens in hypertrophy is that when the organ, the the tissue, you now draw another circle here. You now showed us components inside it, this thing. So the increase in the tissue is due to the increase in the size of the cells. But for hyperplasia, yeah, is due to the increase in the cellular components. You know, like what can contain 11 cellular components cannot contain 4 components. Do you understand? So for hyperplasia, the reason why the cell is expanding is because like the components of the cell itself has increased, so it has to like adjust.
Tell me what you want to add. Akinwale.
Okay, she has said almost everything. Is it physiological? If I say it is like repeating again, sir.
Repeat it, please.
Hypertrophy is where there is a physiological change, where there is enlargement of organ or tissue from the increase, discussed by the increase of the size of the cells. But in hyperplasia is the physiological change where there is enlargement of organ or tissue because there is increase in the number of the cells.
So that is really, please mute your mic, please. Favor, the mic is on.
Yes, sir.
Now, so that is in a nutshell what hypertrophy and hyperplasia means. So moving ahead, these two mechanisms increase the size of a tissue. When there is hypertrophy, the size of the tissue increases. When there is hyperplasia, the size of the tissue also increases. And in many cases, hypertrophy and hyperplasia often happen together. Exactly. It's rare for you to see hyperplasia in isolation. So in many conditions where there is hypertrophy, many conditions where there is hyperplasia, both of them usually occur together. So that's something you have to know. But these two mechanisms bring about the increase in the size of a tissue. If cancer would arise, when you see a woman that has breast cancer, one of the major physical signs that you will see is that the affected breast would be larger in size than the other one. So that is what, and the reason why there is been an abnormal increase in the size of the breast is because the number of cells that are in that breast tissue, the number of cells has increased more than the normal one. So a breast tissue that is expected to have like 5,000 cells is now having 500,000 cells. The area where those tissues will be kept would be bigger than the area where those 5,000 cells would occupy. So that is what is happening in many cases. But when we talk about, the reason why we don't talk about hyperplasia or hypertrophy in the context of cancer is because when they are just hypertrophy or hyperplasia, they are reversible. For instance, like I said, if there is a need for an additional force, if there is a pressure, if there is a stimulus on this tissue that is overworking the tissue would need additional force, additional pressure for it to be able to sustain that particular pressure that it is being put through. So which means sometimes it can embrace hypertrophy, it can embrace hyperplasia. But immediately the stimulus that is responsible for this change is removed, Immediately we no longer see a pressure. Immediately we no longer see the stimulus that is bringing about the pressure. Immediately we remove what is responsible for the hypertrophy or hyperplasia. The tissue will return to its normal size. That is the reason why we called it a physiological change, because it is reversible. It is for a short period of time. It is not permanent. It is not eternal. It is not a change that is irreversible. So it's just for a short or transient period of time. Immediately the stimulus is removed, it goes back to normal. That is the difference between a physiological change and a malignant change. So those two that we mentioned, for instance, when do you think, who knows when hypertrophy and hyperplasia happens normally in the body? What do you think are the physiological causes of hypertrophy and hyperplasia?
But I think the nature of drug the patient is taking can cause it. A type of drug.
Who else has an idea?
So elevated blood pressure. I
You are doing well. When there is an abnormally large supply of blood to a particular region, there can be increased activity. More cells can be quickly produced so that they can handle the pressure. Another thing that can happen is that ordinary growth. Let me use this example. Favor, do you remember your baby pictures? Do you still see your baby picture?
Yes, sir.
Do you know how small you were then?
Yes, I didn't have hair on my head.
Exactly. You now know how tall you are now. The
Yes, sir.
reason for your growth is that more cells have been produced. Okay? Your legs, all the parts of your body that have increased in size since you were born, more cells have been produced over those period of time that the body now requires more space, additional space to accommodate these additional cells. So these processes are actually required for growth. These processes are required for growth. In a pregnant woman, if a woman is pregnant, she has to be feeding for two babies, for two persons, herself and the growing fetus. So there are cells of the uterus because the uterus will enlarge in size. The normal female uterus, every lady that is in this class already has a uterus. But your stomach is not bulging because you are not pregnant. Immediately you are pregnant, the uterus will enlarge. We are still using the mechanism of hypertrophy, hyperplasia, that is enlargement. So these processes, anything that would require the body adjusting so that it can accommodate more stuff in a limited space, is known as physiologic hypertrophy. But if you've seen a pregnant woman before, especially people from the Igbo side of the country, when a woman is pregnant today, when she delivers, there are soups that they give her 2-3 weeks, depending on how serious she is with the regimen. If she even manages it with exercise, you won't even know that she was pregnant. The stomach will be flat again. That means the enlarged uterus has returned to its normal size. And that is what makes it physiologic. If it were to be pathologic enlargement, it simply means that the size would not return to normal on its own without maybe health care intervention, without surgery, without treatment. So that is the difference between physiologic hypertrophy and pathologic hypertrophy or
Sir,
hyperplasia.
please can you say it again?
Okay. I said
please sir.
the difference between physiologic hypertrophy and pathologic hypertrophy or pathologic hyperplasia is that in physiological conditions, when the stimulus, when the stuff that is responsible for that change is removed, things would return back to normal. And I use the example of a pregnant woman. You know, when a woman is pregnant, the stomach becomes enlarged. The baby is kept in the uterus, which means the uterus, every lady that is in this class has a uterus already. But because your stomach is not enlarged because you are not pregnant, there is no baby that is growing in you. But when you are pregnant, the uterus will enlarge. The size of the uterus will enlarge to that very big stuff that you see that pregnant women has. That is physiologic hypertrophy or hyperplasia at work. And we now said when a woman now delivers a baby, the stomach or the uterus will now gradually contract and return to its normal size prior to pregnancy. So I now said if it were to be a disease condition, the uterus will not return to its normal size because the stimulus has not been removed. The stimulus that brought about the enlargement of the uterus during pregnancy is the presence of the baby, is the baby itself. So once the baby is out and there is nothing that the stimulus has been removed, then the uterus will return to its normal. So that is why we said atypical condition. In that case, even though the uterus is still atypical, the cells of the uterine walls, they are atypical, they've been enlarged, they are still not malignant because the removal of the stimulus would return the size of the uterus to its normalcy. Does that make sense to you, Favor?
Yes, sir.
So that is what happens in physiological conditions. And that is why you need to be very, very careful. The secret is just that when the stimulus is removed, then it can return to normal. But another factor that you should have in mind is the duration of the stimulus. If a stimulus appears to stay too long, sometimes it can become irreversible. Go back to that example of the rubber band. When you stretch a rubber band too much, it can break.
It
And
will
it will
extend
no
its
longer
rubber limits.
elastic limit. It will go beyond its elastic limit and can snap and cut. So a rubber band that has been cut cannot be made perfectly normal again. So the duration of exposure to stimulus too is important. I also like using the example of heat. If I turn on a lighter now and I put it and it's on and I put my hand under it, immediately I start feeling the heat. I can just, and I turn off the light, the fire, then even though I can feel some pain on my palm, there is still that chance that things will go back to normal. But if I don't put up the light, the fire on time, and I let it burn my hand for like 10 minutes, there is no way, even if the wound is healed, I will always have the scar for that injury. Things will not remain normal again. And this is really, really important in many disease processes. Let me give you an example of the cervical cancer. What causes cervical cancer is the human papillomavirus, HPV. When a woman has HPV, it's is a cancer that has very slow onset. It takes at least a minimum of 10 years from the onset of infection to cervical cancer emerging. So this is the reason why ladies are always advised to go for pap smear like every 5 years or thereabouts, such that if something is already starting, then it's possible for us to catch it on time. But let's say a woman has been having human papillomavirus. That human papillomavirus has been stressing the cells of the cervix. The cells of the cervix, they've been placed under immense stress. And for consistently, this stress has not been removed. It was not removed over and over again. Then the stress would be too much that even when the virus is removed, the changes that the cells have acquired for them to cope with the presence of the abnormal cell of the virus would have gotten so advanced that it would be impossible for them to go back to normal. And that is what is responsible to cervical cancer. The virus has brought about changes in the cell to the extent that because it was not detected on time, it became impossible for things to go back to normal. So if it were to be that the woman got infected with human papillomavirus today, and like a month and few days later, that virus was detected. Ordinarily, then they gave the human drugs. That would not result in cervical cancer. So because the stimulus that was putting pressure on the cells of this particular region, the stimulus was not removed. In cervical cancer's case, the HPV was not removed on time. It now initiated a cascade of changes that are no longer reversible, leading to the onset of cervical cancer. Salt allusion, does that make sense to you?
So a little was quite confusing. The last part said something about this cervical.
Badi Bololade, can you shed more light for Salter so that she can have an idea what I'm talking about?
So I didn't really understand what you said too.
Who got what I said, please? Chuke, make I sure.
So I understood.
Israel, are you
Sir,
there?
yes, I'm here, sir.
Let me get what you got.
So I didn't understand the cervical part.
What did you get? What did you understand?
Okay. I understood that. After you finish describing the difference between physiologic hypertrophy and pathologic, the another point that we should get is that we should not stretch the the stimulus too much, else we might make it irreversible. As use rubber band as an example, that when a rubber band is being stretched too much, that it can cut, and when the rubber band cuts, it's impossible to return it back to its elasticity and something like that. So you now went to the cervical, the human papillomavirus part, sir. I didn't really get that part.
Precious James. So how far did you understand what I said?
So I'm just coming into the class. I just saw this thing not quite long. So I believe I will listen to it later since it's recorded.
Ivamichi,
Um, Sir, I could only get the part that you said what causes the cervical cancer is when we don't detect the virus that causes it on time, which leads to changes in the system. That what leads to cervical cancer. That's what I only got.
Fever Buna.
Okay, so you were giving us an example of how the human papilloma virus like causes cervical cancer. So you said like you spoke about like when the when the human papilloma virus comes in and then like pressures the cells around it, yeah. So obviously the cells will now like try to like adjust to the whole thing. So if you allow the human papilloma virus to like stay for like a longer time, like you said, or if it's not detected immediately, the cells of like around it will now get accustomed or like they will now adjust immediately to am I talking fast? The cells around it will now get like really like, they'll get adjusted to the fact that they were trying to like maintain or like what's the word? They were trying to bear this burden basically. Then once they take that particular once they adjusted and like increase their their maybe their size or something, then at that point in time it will be too late to start like treating the this thing, and then it will now result to cervical cancer because at that point in time the cells of this thing has already changed.
So how that's clear. So that's in a nutshell what I've been talking about. So that is how cancers arise. Uh, there is no, it's very, very rare for something to happen, just for something subtle to happen right away and result in cancer immediately. So it must be consistent onslaught, consistent exposure to the stimulus. before cancers would eventually emerge. When you look at how when you look at almost all type of cancer, if somebody would have liver cancer, one of the major causes of liver cancer is alcoholism, because it's the liver that is going to metabolize the alcohol that you are consuming. So it doesn't mean that oh, I only took 1 cup of beer once. That is not how cancers arise. So that is the reason why lifestyle of alcoholism is advised against. So if you are someone that smokes, it's because you've been exposing your lung cells for cigarette smoking or anything that you are smoking. You've been exposing the cells of your respiratory system to to cancer-causing agents that are called carcinogens that are loaded in the stuff that you are smoking over and over again. A stick of cigarettes, a wrap of weed will not lead to cancer, but a consistent pattern, consistent exposure to what can cause this particular damage is what would eventually result in cancer. So lifestyle, so is that is that we talk about lifestyle resulting as negative lifestyles resulting in cancer, and not just something that is momentary, something that happened once. Unfortunately, it is not a moral justification for living a negative lifestyle, for saying that, okay, let me just take a cup of alcohol, let me just take a cigarette, a stick of cigarettes, because immediately you start a journey and you've been excited, you've been exposed to it. You want to take, okay, just one more, another, another cup, another wrap. So that is why it is always good for you to even not start this journey in the first place, than for you to start and now struggle on how to stop this lifestyle. So please and please be meticulous and understand what we are talking about today. One stick, a cup of alcohol may bring about may make the cells to be atypical. But immediately you stop this lifestyle, your cells would gradually return to normal. And that is the essence of what we are talking about today. Abnormal cells would cells will eventually become normal when the stimulus has been removed. But when the stimulus have not been removed, has not been removed, and the cells have been exposed to these cancer-causing stimuli for a long period of time, then that is how the changes that have happened in the cell would become irreversible and cancer would develop. Buluwatife Adekoya, is that clear to you?
I think so.
Okay, please, I'm listening.
So for that pathological change, apart from the stress getting used to the cell and everything, can it also be a genetic condition?
Good question. Can you be more specific so I can know if you have a genetic condition in mind? Idris, please, do you have a specific genetic condition?
Dwarfism.
Peace?
So okay, let's say cervical cancer or something.
Okay, thank you very much. When cancer would arise, in many cases, genetics play a very important role in many cancers, but it's not genetics alone, the environment. So many cancers are a product of the interaction between your genes and the environment, or the genes and the kind of lifestyle that you are living. So when you know, for instance, now, when we talk about how the genes contribute to cancer, what we're essentially talking about is that we have some mutations that are, for instance, if your mom if your grandmother had breast cancer, and you also have your mom also have breast cancer, and your mom also has breast cancer, so you have a high chance of also having breast
You
cancer.
have the traits.
So you already have a trait. So you have a high chance of having breast cancer. So that is where genetics comes in. If you got what I said you have a high chance. It doesn't mean that because 5 generations before you have been consistently having breast cancer, that you will automatically have breast cancer. No, because there is still the role of the environment. There is still the role of the lifestyle that you live. For instance, now, if you know you have breast cancer runs in your family, stuffs that we know as carcinogens, stuffs that precipitate breast cancer. For instance, you know if breast cancer runs in your family and you are also taking alcohol, you know breast cancer runs in your family and you are also smoking, you know breast cancer runs in your family and you're exposing yourself to viral infections. It simply means you are also providing the genes, the mutations that you have in your genes already. You are providing them with tools to make the cancer to express. So when you know something runs in your family, it simply means that the major way for you to ensure that you don't have that particular condition is to be intentional, is to be strategic, is to be serious with what you are consuming, with the places you are going to, with stuff that you are allowing to enter your digestive system. Know the kind of things you eat, the kind of things you drink. You don't just drink aflatoxins, stuff that would have free radicals. You take natural stuff that have materials to actually mop up any radiation. You avoid radiation. You know those kind of lifestyle. You live an intentional lifestyle. If you are doing that, you are significantly reducing your chance, because cancers don't arise in isolation. They don't arise in darkness. It's something that that the genes the mutations that you have, that was going to act on. So that is why the genetics play important roles in this thing that we are talking about, so that you don't develop this cancer abnormally. Is that? I hope you got. Is my explanation okay enough for you?
Yes, sir. Thank you, sir.
Chukwemeka Eshe, do you want to say something?
Yes, sir. Sir, please, is dwarfism example of a physiologic hyperplasia or hypertrophy?
Dwarfism is when somebody is shorter than normal. Okay.
Yes, sir.
And we said um, hyperplasia is when
It's
something is
pathological.
long. No, get this thing right. What is hyperplasia? When something is long, when a tissue is longer than normal. So that is what happens in hyperplasia. So which simply means that this is not what we are dealing with in dwarfism. Dwarfism means when somebody is shorter than normal. So for stuff that increase in size, those ones are captured under hypertrophy and hyperplasia. For stuff
Sir,
that
can I ask a question?
let me learn first. So once immediate, but for stuff that are shorter than the normal size, that is captured under what is known as atrophy. Atrophy.
Okay, sir. I got you, sir.
For instance, now, if something is expected to be 5 meters, if
I
something is
muted yourself.
Now, if something is expected to be like 5 centimeters and is now like 2 centimeters, that means the size is smaller than normal. So that is atrophy. For dwarfism, dwarfism is not hypertrophy, is not hyperplasia. Dwarfism is what? Strucomedical history.
Atrophy.
So dwarfism is atrophy.
Okay, sir. Thank you, sir.
So which means the genetic condition brings about the reduction in size, either through you know how we talked about hypertrophy and hyperplasia, when either the size increases due to increase in the number of cells or increase in the size of cells, while atrophy talks about reduction. So which means reduction can either be reduction in the number of cells or reduction in the size of cells. And these two, like we said, in many physiological conditions, these two can also happen together. A tissue can have fewer cells, and the sizes of the cells can also be smaller. So that is atrophy. And which means dwarfism can present with atrophy. So there are many conditions that can result in atrophy. For instance, now, if there is reduced blood supply to a part of the body, if a part of the body is not getting adequate nutrients, which means a tissue that is expected to get like, let's say 50 milligrams of glucose, instead of having 50 milligrams, is now getting something like 30 milligrams or 20 milligrams. In the short term, it can quickly reduce the size of the cells or the number of the cells so that it can cope with the drought, with the shortfall. But if it extends beyond the normal period of time, then there can be drastic drop. The cells that are no longer inactive can actually die off, resulting in permanent changes. So today we've talked about hypertrophy, we've talked about hyperplasia, we've talked about atrophy, and how they are largely physiologic. But especially if the symptom, if the impulse, if the stimulus is for a short period of time. But when it has extended for a very long period of time, and it has been made to be something that is permanent, then this can bring about irreversible changes. And these changes may not become normal again. And there are ways that this presents. For instance, now, it can bring about apoptosis, in which the mechanism that will destroy the cell, if a cell is not getting adequate cell, if a cell is suffering from hypoxia, it's the blood that carries the oxygen. If the blood supply system has been cut off, hypoxia is when the oxygen is not supplied well.
Absence of oxygen.
So when if it's for a short period of time, then the body can quickly adjust to it and look at the way through which it can cope with it. But when it has become like that for a very long period of time, then that can become a pathological and irreversible condition. What happens in ischemia of the brain is when there is prolonged shortage of blood supply to brain cells. Initially, they may want to, for a very few seconds, few cells may die. But when the blockage has been for a very long period of time, it can lead to the death of the tissue itself. So that is how ischemia arises. That is how some brain damages do arise. So that is really, really important for you guys to know. So it's not just any small aberrations, any small abnormalities that result in cancer. So is that clear to everybody?
Yes, sir.
Yes, sir.
So please and please, once you've understood that, then criteria for malignancy is a topic that is very, very popular in histology. And I think almost every one of you would have had that class. So let me know if you don't be shy. If if you are not aware of criteria for malignancy, don't be shy. Let me know and we can quickly go through it. Criteria for malignancy, if you don't know it, let me know. Anybody? Okay, I've had one person that said she's not aware of criteria for malignancy. So, when we talk about criteria for malignancy,
Mr. Dekwadru,
Sonia Alpha, what can I do
I'm
for you?
fine. Sir, please, it's time for the mid semester. I want to.
Hey, go now.
Yes, sir.
Now, so criteria for malignancy. When we talk about malignancy, we are talking about features that are hallmarks, that are characteristic of cancer cells. So of cells that are malignant. So when we talk about cancer, you need to understand cancer. Cancer arises when the mechanism that regulates cell production has been lost. For instance, now, there is always a normal cellular number. There is always a normal number of cells that a tissue is expected to have. So when in the process of replication, cellular replication, immediately that number of cells has been reached, then the mechanism of cellular replication is stopped. So that exact number that the body needs is the number of cells that is produced. But in cells that have cancerous cell, the mechanism that stops that cellular replication is affected. That mechanism that stops it is lost. So which means cancer cells replicate at an abnormally high rate. Another feature is that the rate of replication is increased. So replication that ought to happen in 30 seconds is now happening in a shorter period of time, like 5 seconds. So increased replication and loss of mechanism of replication regulation. So these are the features of cancerous cells. And when we want to, although those things that I just explained, they are mechanisms, they are principles, they are characteristics of the cells. When we talk about when we talk about criteria for malignancy, from the perspective of histopathology laboratory, what we are essentially talking about is that we are talking about what are we going to see in these cells that would make us conclude that these features, these cells that we are looking at under the microscope, these cells are cancer cells. So the number one thing that we are always looking out for is the ratio of the size of the nucleus to the cytoplasm. In cancer cells, there is a larger amount of nucleic materials. DNA materials is larger than normal. And the DNA is packed as chromosome. And the chromosome is kept in the nucleus. Which means, if you remember the hypertrophy, because we now have more DNA for us to keep in the nucleus than normal, the size of the nucleus will now enlarge. So the size of the nucleus becomes bigger than normal. So once we see a very large nucleus, then we suspect that there is abundant nucleic acid material, which is consistent with the characteristics of a cancerous cell. So high nucleocytoplasmic ratio is one of the hallmarks, is one of the signs that the tissue that there is a cancer going. Then we also have multinucleation. Before, maybe the cell is expected to have just one nucleus. When you are now having multiple nuclei in a single cell, Then this is another feature that is consistent with malignancy. Another feature that is consistent is hyperchromasia. In hyperchromasia, we are talking about the staining property in which the cells, the tissues, they are more deeply stained than normal. Especially the nucleus is more deeply stained than normal. It still boils down to the abundant nucleic acid material. We have more nucleic acid material than normal in the nucleus, which means we now have more DNA to pick up the basic dye. Don't forget, acidic dye will stain the basic component of the cell, while the basic dye will stain the acidic component of the cell. Since the DNA is an acidic component, it is going to pick up the basic dye, which is, if you are using H&A, the basic dye is what? Favor, what is the basic dye in H&A? Is it the mastoxylin or the eosine?
So the basic dye, eosine.
Okay, which means the DNA is going to pick up more eosine than it would have normally picked up. And that brings about hyperchromasia. You are going to see it. It will be very, very colored, deeply colored. And it brings out stain. So that is hyperchromasia for you. Another feature is keratinization. Because when cells are being rapidly produced, the check balances, the check mechanisms to ensure that each cell is properly produced before being released is not in place. For instance, now, if you want to produce substances in mass amount, you may have to compromise on quality. So the quality of cell production, the quality of cell replication, and cell maturation, they are compromised. The cells are not well produced. So keratinization is going to happen. Another thing that can happen is the presence of abundant immature cells. The cells are not well mature enough, but because this is cancer, we just have to be churning out cells. We don't have time to ensure that the maturation process takes place. There is a reason why the red blood cells will be destroyed in 120 days. But in the patient that has a cancer of the red blood cancer, such as leukemia, you are not going to be having the red blood cells destroyed in that particular period. In addition, you would have abundant immature red blood cells. They'll be everywhere and they won't be able to serve that purpose perfectly. So these are some of the features that we look under the microscope when we talk about malignancy. And these are the features that you see. And so I hope that is clear to you. Precious James, do you understand now?
Yes, sir. Thank you.
So everybody, in addition to what I know, always have like 10 criteria for malignancy. If you are jotting what I've described, please go and add more to it. So go and add more to it and add them to your notes. So I hope I've made myself clear. Who has any other question for me? Pelumi Akinwale, are you okay with everything we've discussed today?
Yes, sir. It's clear, sir.
Idris, please, are you on board? Is everything clear?
Yes, sir.
Bade Bololade,
Yes, everything is clear.
Amechi Favor,
I'm good, sir.
Precious James,
Yes, sir.
Oluwatife Adekoya,
Yes, sir.
Chukwuemeka Israel. Are we okay?
Yes, sir. I'm here, sir.
So Favor Buna, help us summarize everything that we discussed.
Okay. So, we spoke about hypertrophy from the beginning. We said hypertrophy is like the increase in the size of a tissue due to the increase in the size of the cells, while hyperplasia is the increase in the size of the tissue due to the increase in the cellular component as per the number of cells. And then you spoke about, let me just go down to the fact that we spoke about how you can like prevent cervical cancer, when the human papilloma virus, sets in, or like when the virus starts like pressuring the cells around it, if you how they detect, or rather, what's the word I would use now? How it can be detected earlier. Um, I'm looking for a word to use. But anyways, okay, let me just forget about that. Okay, so you said that the stimulus here, and we said that stimulus is the presence of. Oh, sorry, never mind. I wrote something in my jotter. I'm just reading it from my jotter. You said once the stimulus is removed. So I'm reading from my jotter. Let me just say from my head. Okay,
Yeah.
so you spoke about the human papilloma virus, and like in this type of case, that's the stimulus, the pressure. Once the pressure is removed, it can it's now what's this? What did you say again? It's called a 1 minute, please.
Pelumi, can you help us
Once the
out?
stimulus is removed, it can go back to its original state. Example, that's use the pregnancy thing to explain that to us. The whole pregnancy thing. Sorry, it's because my jotter is a bit scattered. That's why I'm like getting a bit confused. But okay, all in all, yeah, you explained that if you like the whole cervical cancer thing, that's why it's good to always like go for like pap smear test, because if you go for pap smear test, yeah, once you detect that okay, this human papilloma virus is there and it hasn't really been there for too long, the cells have not really like changed shape to be able to adjust to that pressure. You can then start taking things that can actually help you to. But once it has been there for like a very long time, the cells have already started changing form, to be able to adjust to the whole stimulus and pressure that the human papilloma virus was exerting on the cells. As such, that can lead to cervical cancer and all. Then you also spoke about you spoke about atrophy. You said that okay, no. Before I even talk about atrophy, you spoke about pathological and physiological conditions, and then you said physiological conditions. I think you used the whole wait, let me just the whole rubber band thingy or so. You said for a pathological okay, right, for a pathological condition, whether the stimulus is removed or not, the tissue or cell like won't like go back to its like original state, because like okay. Okay, let me use the like pregnant woman thingy now. Okay, so for a pregnant woman now, yeah, once she gets pregnant, the normal cells of the body, like the stomach is not normally like swollen. Do you understand? So, but once that woman gives birth, the stomach and the whole body will start going back to how it was before. So that's like a physiological thingy. But for the pathological one, once it's like a disease, it's like okay, this thing has changed form and then it cannot return back to its original state again. Do you understand? Then you spoke about atrophy, like you used dwarfism for that one. You said that because you said if something is shorter than the normal like size, or like the way like hyperplasia and hypertrophy occur, increase that leads to increase in the size, but for atrophy is a decrease in the size, and there's like a particular standard. So when it's like less than the particular size it's supposed to be, that's when like it's atrophy. And then you said, okay, let me just use that one. If the stimulus or the pressure is for like a short period of time, then it can be reversible. But if it's for like longer periods, then it will become pathological and irreversible. And you also spoke about like you said that cancer arises like when mechanism that stops like cellular production is like breached. When okay, like when cells are like dividing and all. So the mechanism that causes the cell to divide, when it's no more functioning properly again, that the cells could arise. And you spoke about the criteria for malignancy. And you said criteria for malignancy means, when we're looking at this particular cell now, what are we looking out for in this cell that will make us know that okay, this cell has, cancer, or is cancerous or not. Then you spoke about hyperchromasia, you spoke about multinucleated cell multinucleated kidney. multinucleated cells. You spoke about increase in the cytoplasmic ratio. You spoke about increased nucleus. Then you spoke about you said when the DNA. You said like when the cell and the DNA component. Oh, what was this thing you said again? You just said that like like this the components of the nucleus here, the DNA is acidic. So if you use this principle that says the basic dye would stay in the acidic component of the cell, and then an acidic dye would stay in the basic component of the cell. So you said that the DNA is acidic. As such, it's a basic dye. So you said you spoke about hematoxylin and eosin, and you said that the eosin would stain the DNA thingy, thereby making it visible for us. That's the one you spoke about. You spoke about keratinization too. Yes, sir.
Belumi, Akinwale. Pelumi Akinwale, are you there?
Yes, I'm there.
I want to hear your own summary too, please.
So she has said, she has actually said everything, but
Your
she
own, please. You are not using the same brain.
okay. So actually, okay, we started with hypertrophy and hyperplasia, and we discussed that both of them are physiological changes, and we also said they often happen together. That means in many cases they happen together, and the difference is that both of them cause increment of organs, but one is caused by the increase in the size of the cells, that's the hypertrophy, and one is the increase in the number of the cells, that's the hyperplasia. Then we said we talked about pathological and physiological changes. The difference is that the pathological changes, they are actually they are reversible. We now talked about cervical cancer. Then we mentioned when we talk about cervical cancer, I said everything. We said the onset is from 10 years old, for like that's why they say they should check it every 10 years or 5 years now. It's 10 years old that the virus what they say, the virus would make way would cause the cancer, but it cause it's small things that, so if you can get it within this thing, if you can get it, like if someone has the virus and check for it maybe 2 weeks after getting the virus, the thing will revert, like when they give drugs and everything, the thing will revert back to the way the normal cell is normally. And we also talked about hypertrophy, atrophy, using dwarfism as an example. Then yes, we talked about, and it's like atrophy is like the opposite of hypertrophy, and we now said when there is less blood going to a place, it can lead to apoptosis and necrosis. Before we now enter criteria for malignancy, where we talked about this thing. We first talked about the hallmarks, that's the main things, that the mechanism through which cell is regulated, where that one is affected, and where there is accelerated cell replication. Then I mentioned blood, where instead of staying 120 days, it stay more than that, and immature red blood cells also joins it. So there is abundance of this thing, red blood cells. That's in the case of leukemia. And we're not seeing what else did we say? We said the criteria. We now mentioned ratio of cytoplasm of nucleus to cytoplasm. In that case, the DNA. You mentioned something about the DNA is where there is abundant DNA. Then it's because the nucleus to increase in size, to be bigger than normal. That's where we now mentioned hypertrophy again. Then we now talked about hyperchromasia. As you already said, it's where the acidic part is the basic part. And that's where
Yeah, okay, so that was a really, really good attempt. And yeah, I still want to, so I would have liked to stop there, but Precious James, can you give me like 1 minute of what you also got today? I really want to, I've not been hearing much about it from you yet. So let's wrap up the class with you. Let me know what you got.
Okay, sir. I'll just talk about the criteria for malignancy, where you talked that when you said that there are the features that are the characteristics of cancer cells, and then you said that cancer arises when the mechanism that regulates cells are loosed. Then you talked about the features of malignancy. That's where you talked about hyperchromasia, multinucleation, high nucleus keratinization, then the ratio of the size of the nucleus to the cytoplasma. That was all I could get.
So I think that was still fair enough, and I'm going to take that. Please and please, guys, I don't have fire on my head. If you are scared of me, I have nothing to be scared of. So please and please, whatever is still not clear to you, you've paid your money. And my role is to ensure that you understand what we are teaching. So please and please don't be shy to reach out. Reach out on time. Don't make it be around the exam period that will now be rushing up and down to see what we can do to help you understand.
Sir,
I hope. Actually, you want to say something?
yes. Sir, can you just like summarize the characterization? I said whether you can help us summarize that keratinization. I don't get that completely.
Look up keratinization. Look it up, please and please. Okay? Now, next slide, you will tell me, you will talk for 30 seconds. You will tell us what keratinization is. Please. It's just, it doesn't, it's not up to 2 minutes of keratinization. You understand what it is. Akinwale, you can do it. Bale. Sorry. So, guys, that is the end of the class. And yeah.
Sir,
Yes?
sir, how can I get the recording of this class?
Okay, immediately we are done, I will try to upload it and I'll share the link with you guys.
Okay, thanks, sir.
Yeah. So, guys, have
Thank
a
you,
lovely
sir.
day. Yeah, so, take care.
Thank you, sir. Bye bye.